Next we are going to hear from Mary Bussell, who is CEO and co-founder of TriMar Strategies. She's going to be joining us virtually, and she's going to tell us more about going from consensus to action, delivering change for lung cancer in Europe. Thanks for joining us, Mary. The virtual stage is yours.
Thank you very much. Good afternoon. It is a sincere privilege to join you and to engage with a community that has been instrumental in advancing the lung cancer agenda across Europe. My only regret is that I am not with you in person, but I am grateful for the wonders of technology enabling me to join you at your inaugural conference and as it gets underway today. I thank Deborah and I thank Luce for its leadership and the endorsement of the Lung Cancer Consensus Statement. That endorsement reflects not only alignment but shared responsibility. I'm thrilled to know that you each have a copy of the Lung Cancer Consensus Statement in your conference materials. Now, let me share my screen. Can you see it? Yes. Today, I'm going to focus on a single question. How do we translate shared priorities into sustained, measurable action across Europe? The Lung Cancer Consensus Statement, Bridging the Gap in the Diagnosis and Management of Lung Cancer, was developed through global consultation and collaboration. Brings together clinicians, patient organizations, policymakers, researchers, and industry experts. It represents a unified vision and strengthens advocacy, sharpens policy focus, and accelerates implementation. The purpose is clear: to identify where innovations deliver the greatest value and to provide a structured basis for action across the full pathway from early detection, improving how resources are allocated to strengthen outcomes and protect long-term improvements, not simply economic performance. This is not simply a document, it is a platform for coordinated, collective action. The work is gaining global traction. As this map illustrates, the consensus statement has been presented across multiple regions, engaging diverse health systems and economic contexts. These engagements are not simply informational. They connect clinical priorities with fiscal realities, building a shared understanding that lung cancer represents not only a health burden, but is also a persistent and under-recognized fiscal risk, reflected in lost productivity, pressure on public expenditure, and reduced economic contribution from affected populations. We are grateful for the endorsement received from Lung Cancer Europe and 24 organizations worldwide. Together, you all represent a broad coalition of patient advocates, clinical leaders, and global stakeholders. These endorsements reflect not only credibility, but commitment to moving beyond consensus toward implementation and more effective alignment between evidence, policy, and investment. Lung cancer outcomes across Europe remain uneven, shaped too often by geography. My purpose for speaking with you is not to point out where the rates are best or poorest, because we are addressing the issues collaboratively today. Survival, access, and early diagnosis are shaped by geography. This is not due to a lack of knowledge. It's due to fragmentation of policy, investment, and implementation. The consensus statement addresses this directly. It provides a structured, evidence-informed framework to align effort and drive progress. It enables us to move from isolated initiative to system-level change. The Lung Cancer Consensus Statement is anchored in 5 underlying principles that provide a common foundation for alignment across all stakeholders, including ministries of health, finance, and other sectors. These principles support coordinated policy development and more effective system performance. Importantly, and unique to the consensus statement, each principle is accompanied by clear implementation strategies, ensuring that identified opportunities can be translated into practical country-level action. Together, they define a complete approach: prevention, early detection, equitable and sustainable access to care, partnerships and sustainable investment, and tackling stigma and elevating visibility. These principles are not sequential, they are interdependent and must be advanced together. No single stakeholder can deliver across all 5 principles. This is where collaboration becomes essential. Together, they form an integrated framework for action across the lung cancer pathway. Let us now briefly consider each principle and the implementation strategies embedded within them. Let's start with our first principle. Prevention remains the most effective long-term strategy. It requires sustained policy commitment, tobacco control, environmental protections, and addressing social determinants. But prevention is not self-executing. Excuse me. It requires advocacy, persistence, and accountability. Patient organizations play a vitally important role in ensuring prevention remains a political priority over time. Early detection is where we can achieve the most immediate shift in outcomes, yet implementation of screening programs remains inconsistent. The challenge is not only technical, it's relational. We know that the brain processes an image in milliseconds. If individuals do not recognize themselves in health communications, they disengage. Representation builds trust. Trust drives participation. For screening to succeed, it must be trusted, not just available. Patient organizations are absolutely essential in ensuring programs are designed with communities, not simply for them. Advances in diagnosis and treatments have transformed possibilities in lung cancer care. You know this. Access to the advancements have not kept pace with innovations. Equity requires appropriate system design, swift diagnosis, fast-tracked access to diagnostics, and coordinated care pathways that enable rapid referral to treatments. It also requires alignment across stakeholders, clinical, policy, and financial. Equity is not abstract. It must reflect lived experience. You are central to defining whether systems work. This principle underpins everything that has been discussed thus far. Without structured partnerships and sustainable investment, none of the other priorities can be fully realized. At its core, this is about how systems are designed and how they function in reality. As health professionals and policymakers, we design systems and we deliver care, but you live every day within those systems and with your disease. You live the reality of the disease throughout its course every single day. The distinction is vitally important because it is your lived experience that ultimately defines whether systems are working as intended. This is also where investment becomes strategic, not symbolic. Investment in lung cancer must not be viewed solely as an expenditure within health systems, but as a driver of outcomes, productivity, and societal value. When we invest early in prevention, in early detection, and in effective care pathways, we do more than improve survival. We enable you and your loved ones to return to meaningful roles in families, communities, and economies. But this requires more than funding alone. It requires partnerships that are sustained, structured, and accountable. Patient organizations are central to this effort. You bring lived experience into policy design. You strengthen alignment across stakeholders, and you ensure that both health and finance ministries understand what is at stake, not only clinically, but humanly, economically, and socially. In this way, investment becomes not only a health priority, but a shared societal commitment to value, dignity, and productivity. Stigma continues to shape how lung cancer is perceived and prioritized. It is a heartbreaking reality that I strive to change every day. It influences help seeking, policy prioritization, and funding decisions. Representation matters. When people see themselves reflected, the narrative shifts from blame to understanding. Your voices are central to this shift. You humanize the issue and elevate its urgency. Our focus now is implementation, guided by 4 priorities. By uniting global efforts through the consensus statement, we drive meaningful change, we highlight opportunities for improvement, and ensure that those at risk for and living with lung cancer receive the care needed. The consensus statement is only as valuable as its implementation. At the European level, alignment creates momentum and visibility. At the national level, commitment drives delivery and accountability. This requires coordination across sectors and sustained effort. You are central to this process in driving advocacy, monitoring progress, ensuring that policy reflects lived experience. This is how consensus becomes measurable change. The consensus statement provides something rare, a shared framework, a shared language, and a shared direction. The responsibility now is collective. You, as people living with lung cancer, and your organizations are not the only voice of those affected by lung cancer. You are the architects of change. By championing the lung cancer consensus statement within your countries and among your own networks, you can help to ensure that governments invest wisely, improving outcomes, strengthening economies, and enabling people to live meaningful and productive lives. Thank you for the honor of allowing me to speak with you today. Consensus gives us a shared voice. Collaboration gives us strength, but it is action that will ultimately change lives. Thank you.